Welcome to the Dr. Dad's podcast, where a naturopath and chiropractor come together each week to share lifestyle medicine, health advice, and inspiring interviews with some of the top experts in health and wellness, bringing you the latest in nutrition, exercise, ancient healing, toxins and detox, your microbiome, mindset, hormones, brain, and much more. Stay tuned. We're going to teach you how to experience growth daily.
What's up, everybody? I gotta say, I get super excited when we get a chance to talk to another Dr. Dad. And so we've got a special guest today. David, how are you, buddy?
I'm fantastic, brother. How have you been?
Good. Yeah, we were just talking about being on the slopes before getting on this call, and I happened to be out there, not Whistler, but another local mountain called Cypress, and we were teaching my little guy how to ski, or I should say I was watching while he was getting a lesson. It's funny because when it's me teaching him, it's funny, like all that, those cool, calm parenting skills that you really want to show up as, they just don't come across all that well when you're trying to teach your little guy to ski. So we figured that it was time to put him into a lesson.
I've learned that valuable lesson. Oh yeah, man, I'm with you. I've learned that valuable lesson. Let somebody else teach them. They'll probably listen better.
Exactly. So anyways, we're going to talk to a Dr. Dad, and I'm going to introduce him a little bit. And basically, one of the things that David and I have talked about in this podcast many times is about performance and how to show up as a better, not just a better man, but a better human. And what are some of the things that maybe we're missing in our health plan, or how do we feel more optimal in our body? And we know the hormonal system plays a huge role in that. But speaking to these expertise, it's great. I mean, I feel so fortunate that we got a chance to connect with our guest today, because he's going to bring in all this amazing information. He's got this Bible of a book that I've just been loving. There's so much crazy good information there. It's called The 21st Century Man by Dr. Judson Brandeis. And so he's an award-winning urologist and sexual medicine expert, clinical researcher, physician, educator, and a caring clinician and surgeon. He's a graduate of Brown University and Vanderbilt University School of Medicine with urologic. Man, goodness, Judson, how do I say that? Urologic surgery residency at UCLA and a postdoc fellowship at Harvard. Today he specializes in the emerging field of sexual health and medicine. Dr. Judson, thank you for correcting my English and for being here with us.
Oh man, it's a mouthful, huh?
Yeah.
Well, it's amazing. I mean, I don't always love going over someone's bio, but it adds so much credibility to the kind of doctor that you are and the kind of experience you've had. So there was a part in the book that I'd love to start with, and it was one of your last chapters, and is really speaking to your adversity. Because I think what's really helpful is to appreciate the gentleman that we're speaking to as a really an individual who's gone a long way in his field of expertise, but also the man and his character. And you went through some challenging times, kind of dismantling the relationships you had with your current business situation that you're in, and then you went into private practice. Can you start off a little bit of just giving people a sense of what life has been like over the last couple of years, and let's dive in.
Yeah, I mean, that was my hero's journey. Everyone has an opportunity, I think, in life for a hero's journey, and that hero's journey can be when you're 12 or 15 years old. It can be when you're 20 or 30 years old. For me, it was when I was 50. Right. And it wasn't that I hadn't done anything difficult up until that point. I'd done a lot of difficult things. I mean, I went through a surgical residency where I was up every third night for 6 years. So that was really tough. And I had pioneered surgical robotics and done some really amazing things. But it wasn't until I discovered sexual medicine and went in a different direction than my partners did. And all they wanted to do is sell themselves to the hospital. And I just decided, listen, I'm not the kind of person that likes to work for other people. I like to work for myself. I like to be creative. I'm driven, and I don't want to work for the hospital. And they rewarded me by firing me and unceremoniously firing me. And it's a really long story. I don't even get into a fraction of it in the book. But I went from, one day making a decent living in a job that I've had for 20 years and really the only job I'd ever had, to the next day not having a job, not having a source of income, having 4 kids in junior high school and high school, facing 4 college tuitions, 4 graduate school tuitions. And, urology jobs aren't like primary care jobs where there's a lot of them. Maybe in a city, there's a handful and we all know each other. Everyone knew the whole story. And so I had to pick myself up. I mean, there was one day where I was furious, the next day where, I was just in total disbelief. And after that, I just had to start working my ass off. And I had to be creative, and I had to pull in every resource that I had accumulated over 20, 25 years. And it really took a good 3 years. COVID didn't really help things in the middle of all that for me to put together the medical practice that I have now, which is, I just love going to work every day because I can make such a dramatic difference in people's lives. So I used to do the whole people are sick, let's get them better. And now I get a lot of men who are in pretty good shape, but I teach them how to excel. I teach them how to be proactive about their health, how to build muscle, improve hormone therapy, lose weight, improve sexual performance, and understand sort of the psychology of getting older and how to maximize their life potential. It's really cool.
It's amazing. I always love hearing these, really influential people that life makes sense. It's comfortable. It's, and then there's a bump in the road that really is, it's like an activation really. And that's the way I see it, that the people really get to rise up in a whole new way that they weren't just paying attention to before. And the circumstances, as challenging and crappy they were to go through, no doubt, it's really like what allowed you to really, shine in a new kind of way, complete this. I mean, this is a thick book, people. It is full of amazing information. And, it's kind of like this cherry on the top, I imagine, for you to be able to really share in a new kind of way.
Yeah, I mean, I understood that one of the real talents that I have, and we all have talents in life, one of the talents that I have is really to connect with patients, that I genuinely care about my patients. And I'm really good at explaining difficult concepts in a way that people can understand, and especially connecting with men. I understand how to motivate men. I understand how to get men, get their ass off the couch and really do the things that they've been trying to do for a long time, but they just don't quite understand how to motivate them. And a lot of times when their spouses come in to see me, they pull me aside and they're like, listen, I've been telling my husband to do these things for 20 years. And for some reason, he listens to you, and I don't care who he listens to, whether it's me or you, I'm just glad that he's doing it. And it's just that over the years, I've seen thousands and thousands of men, and I just kind of understand the secret sauce of how to get inside a man's head, whether it's like I had a patient who was a dentist and had been smoking all his life and just couldn't quit. And I said, the only thing I want you to do is write 13 years of life lost on a piece of paper and put it up on your daughter's door, their bedroom door. Wow. So that every time you walk into their room, you realize that if you continue to smoke, you're going to lose 13 years of your life expectancy. And, he came back to me 2 months later and he's like, you know what? I stopped smoking.
That's amazing.
So sometimes it's that. And sometimes it's, there was this patient I had who I could tell he and his wife were going sort of in separate directions, and he was hiding at work. He didn't have to work nearly as much as he was working because he was pretty wealthy. And I just looked him in the eye and I said, what the fuck are you doing? And he just was like, you can't talk to me like that. Yeah. And 2 weeks later, he came in and he's like, I really want to thank you for what you said to me. And I was like, okay, I was a little nervous about it. And he said, I just needed someone to look me in the eye and just shock me into realizing that I was hiding from what I needed to do. And so it's, everyone needs tough love in their own way, including me. I'm not immune to any of this stuff. But I've learned a lot over 25 years, not just about urology, not about sexual function and muscle building, but just about men and how to motivate them. And this book was kind of like the culmination. I wanted to be able to reach not just the 2 or 3 new patients that I see every day, but I wanted to be able to reach thousands of men or hundreds of thousands or millions of men and give them every ounce of knowledge that I've accumulated over my career. And then also because I don't know everything about everything. So who's the cardiologist that I turn to when I have questions about the heart, or who's the ophthalmologist that I have questions for when I have issues with the eye? And so this is just my network of folks from Brown, from Vanderbilt, from Harvard, from UCLA, from private practice up in Northern California, because we have a great medical community up here, and just kind of the accumulated intelligence of all those people.
Yeah, it really felt like, going through the book, it really felt like it was a tribe, like it was this massive community that was, supporting the work that you're delivering to the world. And I mean, it really feels like, hey, I want to learn a little bit more about, I don't know, muscle building, or I want to learn a little bit more about heart health, or want to learn a little bit more about something. And just the way that it's laid out, I think is really, it's practical. It's very informative. And so there's a lot of nuggets in there that I think they're going to be really helpful for so many men and women too. I mean, I love the stories you shared about that, really knowing how to build that rapport to connect with someone in order to elicit or support a change to take place. Because, I mean, how many times, like all of us men see often the wives come into the clinic first and they start talking about their husband and saying, I would really love to see my husband change maybe some behavior. And sometimes it, takes that little bit more provocation as a man to snap out of it. There's something within you that's calling you forward to be a better version of yourself. So I love that. I want to get into some of go ahead.
I mean, an amazing gizmo I have in my office is an in-body body composition analysis machine.
Right. Yeah.
So, you can see what the percentage of body fat is, how much fat you're carrying, what your left arm is, what your right arm is, what your legs are. Guys respond to numbers. Women, I think, these are all generalizations, but women look in the mirror or look at pictures and say, I need to do this, I need to do that. But guys love numbers. Mm-hmm. And when you can move the numbers for them, they really get motivated. And I've had I have this series of men over the age of 60 where I have a muscle building and fat loss and overall health protocol where I can build 5 to 10 pounds of muscle in men over 60 while I'm losing 10 or 20 pounds of fat for them. It's just astonishing. And it's just like, these guys just blossom. It's really just amazing.
That's awesome. Well, that's one of the questions I want to dive in with you a little bit more in detail. And then what I want to do is just go through some of the more common, I guess, complaints that men have, when they hit their 40s and things start to go south, so to speak. But before we go there, David, do you want to lead in with anything?
No, I'm just listening to him talk. I have a couple of questions just off what we're talking about before we jump ship to something else. Is, you're a creator, right? And that's a big part of who you are. Did you see a big change when you went from, the hospital type setting and you got to step into this private practice of getting really to just kind of shine through with what you were wanting to do? I know you've come a long way in just 3 years, but what's it like now for you, man?
Yeah, I was kind of dragging my group along, because I had a lot of the really innovative business ideas. I've always been one of these people that sees sort of what's coming down the pipe. Like, we had the second Da Vinci surgical robot in the country. I was one of the first private practice guys in the country to use an MRI-guided prostate biopsy system. I was about to initiate a DNA testing, RNA testing of microbiology before I left the group. I mean, I'm just I see technology and I'm like, God, that's the thing that's going to be next. And so now that I don't have anyone to slow me down, it's really amazing what I'm doing. I mean, I have this study called the P-Long study, which is a penile elongation and augmentation study. Right? It's listed by the NIH, clinicaltrials.gov. It's IRB approved. And to be perfectly honest, I could care less how long guys' penises are, but because of what I do, I see the disasters. So guys that go for penile augmentation with fillers or fat, that only lasts for a couple of years, and then you get this lumpy, bumpy penis. Or guys will have surgeries like the E-list implant or ligation of the suspensory ligament then, and you can have disastrous complications from that. So I see these guys and I'm like, well, there's got to be a better way, because more than 50% of men want to have a bigger penis, right? 300,000 women a year get breast implants. So let's not be judgmental, right? More than 50% of guys want to have a bigger penis. So I use the combination of PRP. I have a double spin, high volume PRP machine, and a traction device and a suction device and a supplement that I make called Affirm, which is a nitric oxide boosting supplement. And I'm getting amazing results, improving both length, girth, and function of the penis. So that was just like, an idea I had. I connected with Charles Runnels, who invented the P shot and the O shot and the vampire facelift. He gave me a little bit of money and some kits and off and running. And, by the end of the year at the Sexual Medicine Society of North America meeting, I'm going to be presenting this data. And it's like, guys have been trying to get their penis bigger for 2,000 years. And here I am in San Ramon at this, little office and figured it out.
That's awesome.
That's amazing.
It's like, what the hell?
You're gonna have people wondering, like, what are some of those results? Like, what are you noticing? What are the
we're getting about almost an inch in length and about a quarter of an inch in girth over a period of about 7 months. And it's symmetrical growth, whereas some of these things, like if you squirt filler or fat in a penis, you get a thick shaft, you don't get any better length, and you still have a thin head, so it looks like a pig in a blanket. Wouldn't want to eat it, but that's what it looks like.
Oh man,
well, that's awesome. So you're outside of your box now, and I'd imagine that like you're just shining, man. And I bet you're
I had another study I presented at the SMSNA a couple months ago on using high intensity focused electromagnetic waves, so something called the M-Cella chair, to improve the intensity and duration of ejaculation.
Oh wow!
It's the first technology ever to improve ejaculation and orgasm, which I'm not curing cancer, but it's something.
The quality of life, man. I mean, that's huge.
Yeah. And I had a patient a couple of months ago. He's a 65-year-old attorney, hadn't had an orgasm in 5 or 6 years. And he came in to see me a couple of weeks after we had started treatment, and I could see a tear in his eye, and he just came and he gave me a big hug and he said, it's the first orgasms I've had in 5 or 6 years.
Wow.
I mean, it's just really cool. I mean, I'm giving people back a part of their life that's really important to them, that gives them quality of life, not just quantity of life.
Mm-hmm. I love that when we got into the male sexual health problems, we just hit the ground running, went right to penis length, and I think that's a fun way to start. What's the expected frequency for someone to come in for those treatments? Yeah, even for the other gentleman that you spoke to.
Yeah, once a month. Well, so for the P-Long study, it's PRP once a month for 6 months, and the traction and the suction and the Affirm supplement.
Cool. So where are we injecting the PRP? And for people who maybe don't know what that is, platelet-rich plasma. Are you talking just under is it a subcutaneous injection?
No, it's in the corpora. So the penile anatomy, you have 3 tubes. You have a left and a right tube. Those are called the corpora cavernosa, or the erectile bodies, and those are the ones that fill up with blood and feel firm. And they have a really tight, thick fascia around them. And then the urethra is the tube that goes below the corpora. And the joke is always that, God was an engineer because he put a recreational line put a waistline through a recreational area. Right. And so, so platelets in the body have 2 functions. So probably most people out there don't know what PRP is. So PRP is platelet-rich plasma, and platelets have 2 functions. One is to cause a clot, but the second is really important also, and that's to initiate proliferation of cells, right? So it's actually God, the good Lord, designed this beautiful system where the platelets race in there. They form a clot. When they become activated, they put these arms out called pseudopods. They grab onto each other. They form this web. Fibrin and red blood cells and all this stuff gets caught in there. It forms a clot. But then when the platelets put their arms out, they release these things called alpha granules, and alpha granules are packed with growth factors. So 141 different growth factors have been identified in platelets. So it's kind of like my plumber, when he comes to the house, he has this big truck and he's got every pipe and fitting known to man, right? So platelets have to have every growth factor known to man, because the platelets don't know whether they're going to be fixing brain tissue or spleen tissue or toe tissue or whatever. And so if you isolate the platelets from blood, and you do that by throwing it in a centrifuge, the red blood cells have iron, so they go to the bottom. The plasma is just water, so it goes to the top. And in the middle, you get the platelets and the white blood cells. So if you suck out the platelets and the white blood cells, then you can use that to stimulate growth really anywhere in the body. So in orthopedics, they inject knees and hips, and you hear all the time about basketball players and football players getting that to accelerate healing. You can also use it for your hair. It will improve density of hair growth about 20, 30, 40%. And you can inject it into the penis or the clitoris or the face to accelerate the growth of those tissues also. And so, it was really interesting. My wife was pregnant with our twins long time ago. She had braces put on, and her orthodontist just couldn't believe how fast her teeth moved. He said, your teeth move 3 times faster than any other patient I've ever had that was an adult. And the reason is because she has so much growth factor floating around because she had twins, that the teeth moved really fast, because when you move something, you break something down and then rebuild something. And so that was the principle that I used when I designed the P-Long study and when we use PRP for a variety of things.
And there's a synergy there, right? Like, are you using the shockwave machine along with, you said there's a suction device, and so there's some synergy there with some of the other different.
Yeah. So we don't, in the P-Long study, we wanted to basically isolate that the PRP was responsible for the growth. So we intentionally didn't use the shockwave therapy, the Gainswave, because, that way you're not quite exactly sure what's working. But, it made sense to me intuitively that you use growth factor and then you guide the growth.
Mm-hmm. Yeah. Love it. That's awesome. I'm sure you're going to get a lot more phone calls. Not that your phone's already ringing off the hook, but so let's jump into some other stuff. I mean, because that's a big one, right? How men feel about their body. Another one, let's talk about prostate health. I mean, this is a common misconception, maybe for some people. Like, there's a whole discussion around testosterone supplementation or injections and things like that around the prostate. Is this good? Is this bad? What about the estrogen? What are some of the things you think about when it comes to prostate health?
Yeah. So Gary Donovitz, who's the CEO of BioT, which is the largest testosterone replacement company in the United States, wrote an amazing chapter on testosterone. And I wrote the chapter on prostate. And so, the 2 main issues, really 3 main issues, but prostatitis or prostate infections are relatively uncommon as compared to an enlarged prostate and prostate cancer. An enlarged prostate tends to be a benign process, and that benign process obstructs or restricts urination. And so guys tend to get irritative or obstructive voiding symptoms. So irritative symptoms are like urinary frequency, urgency, getting up at night to urinate, burning on urination, blood in the urine, urinary tract infections. And then obstructive symptoms tend to be like a slow urinary stream, or, waiting a couple minutes to get going, or intermittency, which is stop and start, or feeling like you're not fully emptied at the end. And so the prostate does make, the testosterone does make the prostate grow. Testosterone gets converted into something called dihydrotestosterone, and dihydrotestosterone is responsible for accelerating the growth of the prostate. So when we hit 40 or 50 or 60, you get a higher percentage of what we call DHT, and you get all those wonderful things like hair loss on your head, nose hair, ear hair, and an enlarged prostate. And that's why a lot of people take a medication like finasteride or Proscar, because that blocks the conversion of testosterone into dihydrotestosterone. But there's, in the prostate chapter, it's really written as an advice chapter. It's not written as a reference book, because the thing is, for example, when I started doing robotic surgery in 2002, I went back to UCLA in 2004 and I said, this is amazing. you guys got to see this. I have a videotape of me doing a robotic prostatectomy, and I can see the anatomy so much better than I ever could doing it open. And my professors were like, nah, there's no way you can do a better job than we can do it open. And then 2 years after that, all of a sudden they decided, wow, not from me, but like watching from some other people, this is great. And then 2 years after that, they're teaching everyone how to do it. Same thing with UCSF. I used to get the referrals from UCSF in 2003, 2004. And then by 2006, all of a sudden they become the experts. So the chapter is filled with stuff that will probably be standard of care in 2, 3, 4 years. For example, in the chapter, I say, anyone with an elevated PSA, if your urologist wants to do a prostate biopsy, make sure you get an MRI before you do that. Right? And still, probably 50% of urologists in the country aren't doing prostate MRIs. But before I was doing prostate MRIs, a third of the time when I did a prostate biopsy, I would come up with cancer. And that was pretty standard. Almost everyone in the country, that was about the ratio of biopsies to prostate cancer. And when I've been doing them with MRI guided biopsies, I'm at 85%. So I'm not biopsying the guys that don't need it. And when I am biopsying guys, I'm making sure that I actually get the tumor. So, but that's not quite standard of care. It'll probably be standard of care in a year or 2 or 3, because not everyone has the technology. There are still sort of papers to be written. But as a private practice urologist who kind of understands how technology evolves, I can say what I want. I can give you my opinion. And that's the beautiful thing about this book, is that they're experts in every field relating to men's health, but no one in the book is held back because they're at a fancy university or they're going to be criticized by their colleagues for what they're saying.
Love it. Go ahead, David.
No, and that's beautiful. We need that. I mean, kind of like you were talking earlier, there's a lot of hurdles to jump for a lot of people because they're afraid of saying something because of an invested interest they have in something, or they don't want to offend this, or legals and stuff like that. So I love it that you got all these people in this book to really just share the medicine of what is needed and where to, just the prostate thing, like get an MRI before you do a biopsy. That's huge. Most people don't know that. And they're just going to take the advice of their doctor, and because apparently, I guess we know everything, right? And so that's typically what happens. We've all probably heard horror stories from patients that come in where they did things that were like, oh my God, why did you do that? But yeah, man, it's huge. This information needs to be shared, and my hat's off to you, man, because this stuff's so important. And it's almost like you have the man's Bible to take care of himself, man. So,
Randy Hetrick, the head of TRX, called it the Dude Bible.
Yeah.
Love it.
So, and you get to a point that I think is really important, as all three of us being doctors, that I don't believe in the model of, the doctor on the top of the hill telling everyone what to do. Especially in this day and age with health insurance, which fortunately I don't take health insurance anymore, but Cerner did a study, looked at 100 million charts and figured out that people are at their doctor's office for 16 minutes and 14 seconds, which is not a lot of time. And so I encourage my patients to form a partnership with their doctor. And what I mean by that is, it's your job to give your doctor the information that he or she needs to do a really good job taking care of you. And what that means is you come in with your medical history, you come in with your medications, you come in with your labs, you come in with your imaging studies, you come in with a history of present illness, so that you say, I hurt my back a week ago, it hurts more on the left side than the right side. It started out as a 10 out of 10, now it's a 5 out of 10. I took Advil. I had a similar episode of like this 10 years ago, and I got an MRI, and I want to get an MRI. And then you come in with a list of questions, and you type it all up, and you hand it to your doctor at the very beginning of the visit. You'll get a big smile from your doctor. Your doctor, I have a dictaphone. I just voice dictate. It'll take me 3 or 4 minutes to pull through all the pertinent information. And guess what? All of a sudden, if I only have 16 minutes to see you, I got 13 minutes to ask you a bunch of more follow-up questions, formulate a plan. tell you what I think I'm going to do, prescribe some medications, tell you about the side effects of the medications, and then give you an opportunity to ask questions. But if that doctor has to sit there and pull information out of you, at 15 minutes, he's going to start looking at his watch going, I got another patient coming to see me, and I don't really have time to explain everything to you. So, don't go in there talking about the weather, talking about, your cat. I mean, my lawyer is $750 an hour. I know it's like $12 a minute when I go to see him. And I'm not going to talk about my pet cat or the 49ers. When I get there, I see this little meter running and I'm down to business. That's the way you have to be with your doctor. You want to make sure that you get the most out of that visit and you're there to take care of yourself.
I love that. Such a good message, especially the partnership. I think for too long, doctors have been that sort of pedestal. And I know in my practice, I've always tried to make an effort to really communicate that, you're my boss. I'm here for you. So let's make the most of our time together and let's really dig in and get to the root of what's going on. So I love that.
And information's, ubiquitous now. I mean, it's like when I was at Harvard doing research, Harvard Medical School library had 1 million volumes, and people around the world would come to spend days in the Harvard library looking stuff up, right? But now you got a little cell phone that has as much information as the Harvard library has. So my patients come in with stuff all the time, and I love it because I can't be looking at everything on the internet. So sometimes I'm like, well, I actually know what this is. If you look at the ingredient list, it's the same as this. And sometimes I'm like, this is just a scam. These people are it's just a marketing ploy. And sometimes I'm like, you know what? Why don't you leave this with me? I'm going to look it up and I'm going to see if there's any merit to it. I mean, someone about 6 months ago was asking me about Botox for erectile dysfunction. And I thought about it. I'm like, the mechanism of action might make sense. I looked up some stuff. There really wasn't that much in the literature. And then lo and behold, a week ago, there was an article that came out that was really well done that talked about Botox injections for men who, had erectile dysfunction, and it was marginally beneficial. It was a fairly significant dose of Botox, so it's not cheap, but in the right patient at the right time, it might make sense. So it's always, for me, it's always important to listen to my patients and listen to the things that they bring in to me.
Yeah, I love that. So, you brought the next topic up that I wanted to address, and that's erectile dysfunction. So, what are some of the key things that you might illuminate for people when they're coming in with that symptom?
Yeah. So the key thing for me, one of the key things for me is erectile dysfunction is a circulation issue. Circulation problem. Okay. And when you're 20, when you wake up in the morning, every morning you have morning wood, right? Every guy knows that, right? But at some point you lose that, whether it's in your 30s or 40s or 50s. So you have to take notice of that, because that's the first sign that things aren't working the way they should be, right? That's the first sign that your circulation is declining. And that's a great time to do something, because guess what? 10 or 15 years after you lose morning erections, you're going to be having sex one night and things aren't going to work as well, right? And if you had done something 10 or 15 years before, like clean up your diet, exercise more, stop smoking, get out of that super stressful job, take a nitric oxide booster. So I make a supplement called Affirm from Affirm Science. That's a nitric oxide booster that improves circulation naturally. It's basically beets and watermelon. Those are the simple things that you can do that will push back that day when things aren't going to work. Because for everyone, at some point in your life, things aren't going to work as well as they used to. Okay, but then say you're in your mid 50s and you have those nights where things aren't working anymore. Guess what's going to happen 10 years after that? So in your 50s, the 1 or 2 millimeter arteries that go to the penis are getting blocked. But in your 60s, the 3 to 4 millimeter arteries that go to your heart, called the coronary arteries, are going to get blocked. So if you don't wake up and understand that you have a circulation issue in your 50s, then you're going to have a really big circulation issue in your 60s. And no one likes to really think about that, right? Like it's not cool to think about erectile dysfunction as a circulation issue. For example, like say you're at work and you got to take your dad to the cardiologist, right? And you tell everyone in the office, hey guys, listen, I'm going to be out this afternoon. I'm taking my dad to the cardiologist. He's having some heart problems. And everyone's like, oh, that's so nice. What a good son. You're taking your dad to the cardiologist. Then the next week, you're like, hey guys, listen, my dad, he's got to go to the urologist. He's got erectile dysfunction. So we got to go get his dick checked at the urologist. You're not going to get that same reaction of warm fuzzy from the people in the office. But guess what? It's the same problem.
Yeah.
It's just a different organ.
Yeah. Mm-hmm.
And it happens 10 years before you got to take your dad to the cardiologist.
That putting those two together is massively important, because I think in some cases men are more motivated by, their member and not getting that morning wood than they are their heart even. So to link those two together, man, that's huge, because obviously the fear of heart attack is also a strong motivator for many people, but it's that early sign of things aren't working properly. I love that. David, go ahead, bud.
No, I'm with you on that, man. I mean, most people don't make anywhere close to that association, right? And so they're not seeing that clock ticking little by little and leading to some other health issues. But you're right on, man. I mean, it's so important. Circulation, that's the superhighway, right? If we're not starting to carry things well, the body starts degrading in other places.
Yeah. It's interesting. So the heart pumps, and the two last places to get blood are the toes and the penis. Right. But
So
you don't get toe erections. I was giving a talk at this golf club one time, and I was explaining that the penis is the last place to get blood. And the guy's like, well, how come God just didn't put it right here in the chest?
Oh my God. That's too funny.
Oh man, it's really fun talking about this kind of stuff.
Well, I love it because like you let up when you're talking about this, and I think it just goes to show that your ability to reach people is because you make it fun, but you also make it really impactful and important for people to listen to. So,
we laugh so much at the office. It's really fun. I had this one guy, right? So we're doing so we do a P shot when it's part of a package. We charge a little bit less than when it's not part of a package. And so I told this guy, it's part of a package. We'll charge you X amount of money. And I didn't tell the gal at my front desk. And so she's trying to charge him a little bit more. And he was getting upset. And I'm sitting in my office, and my office is pretty close to the front desk. And so I hear what's going on. And so I walk up there, and I'm like, oh, dude, I forgot to tell you that we charge by the inch.
How do you respond? He must have.
He lost it. He fell over.
Awesome.
Okay, well,
so it was nice to diffuse that situation in that way. But okay, so if you don't mind, I'll get back to the development of erectile function. Okay, so you don't get toe erections. Okay, when blood pressure decreases to the toes, you get cold feet, and you put socks on, and that's the end of the story. But the penis is different. With the penis, you have to achieve a certain level of blood pressure in the penis in order for the penis to work. And the way the penis works is as you increase the blood pressure, it blocks the backflow of venous blood back to the body. So it traps the blood in there, so you get a rigid erection. And the artery in the center of the penis continues to pump blood in, but the veins, which have thin walls, get trapped, and the blood gets trapped inside the penis. So you have to hit a threshold blood pressure. So think about it this way. If you're on a burning building and the next building is 6 feet over, if you jump 6 feet, then you're in good shape. If you jump 5 feet, it's a long way down. So in the penis, if you achieve a blood pressure of say 100, it's a good night. But if you achieve a blood pressure of 95, it's not going to be a good night. And so the goal of when a patient comes into my office is how can I improve the blood pressure in the penis, and how can I eliminate things that will decrease the blood pressure to make it more difficult. So things like stress, anxiety, create adrenaline, epinephrine, or cortisol, which decrease blood flow to the penis. So that's part of it, the psychological aspect. And then there's a whole physiologic aspect, which includes nitric oxide boosters like Affirm, PDE5 inhibitors like Cialis and Viagra, and then regenerative urology treatments, which is what really attracted me to go into sexual medicine, which is like low intensity shockwave therapy, platelet rich plasma, penis pumps, and then some other really interesting things like peptides and stem cells. And I'm doing high intensity focused electromagnetic wave trials to see if that improves erectile function. I mean, it's a really exciting field. It really is.
Mm-hmm. Yeah,
So-
no kidding.
Go ahead, Nick.
I just want to ask, like, I mean, the sheer number of people with cardiovascular disease, and you spell that really well in the book too. I mean, just the amount of people on blood pressure medication, what kind of impact is that playing on erections?
Okay, so let me explain blood pressure medications. And blood pressure medications aren't bad. High blood pressure is bad. Okay, but when you get put on a blood pressure medication, it's kind of a slippery slope down. So your heart is a pump, and as it pumps blood into blood vessels which have a certain resistance. And when you're younger and the blood vessels are more elastic, that resistance is lower. So you get much better perfusion of blood out to the periphery. Okay, but as you get older, the blood vessels get more stiff, and so there's more resistance, so the heart has to pump harder. And when the heart pumps harder, we call that high blood pressure. Okay, and your body measures blood pressure in two places. It measures it in the neck, in a place called the carotid body, and it measures it in the kidneys. Okay, and the reason for that is because, one, blood pressure in the brain is the most important thing. If you lose your brain, then, life's over. And the second most important, one of the second most important places is the kidney, because the kidney monitors electrolytes, monitors blood pressure, and removes waste. And so those are three really super essential functions. And so that's why your body monitors blood pressure there. So if the blood pressure is high, your heart's working really hard, and you don't want your heart to work too hard because the heart will give out, or the muscles in the heart will get too big and it'll make the heart difficult to pump. So you give blood pressure to automatically relax blood vessels. Okay, and so then the carotid body and the kidney say, oh, great, we got better blood flow. So you know what, we're going to send message to the heart, listen, you don't have to pump as hard. And the heart says, great, I don't have to pump as hard. But the hands, the toes, and the penis are like, what's up with that? We're not getting the same blood flow that we used to get. But they have no way of communicating that to the heart, because the carotid body and the kidney override everything in the body. So any blood pressure medication that you take, if you look at the list of side effects, it will include erectile dysfunction. So what I like to do is to use nitric oxide. And when I was at UCLA, my professors won the Nobel Prize for discovering nitric oxide as a second messenger. And they discovered the mechanism of action of Viagra. And if you take a nitric oxide booster, you increase the transmission of signals between nerves and blood vessels. And so you open up blood vessels naturally, not just blood vessels centrally, but also peripherally. So for example, my blood pressure usually runs 120/70, but I take 2 Affirm tablets at night and 2 Affirm tablets in the morning. And this year my blood pressure was 110/65. And I routinely get my patients off at least one blood pressure medication. You shouldn't just start taking Affirm and then go off your blood pressure medication. I have them take their blood pressure every day, morning and night, with the same blood pressure machine at the same time while they're on a nitric oxide booster, and then ask their physician permission to try to get off one of their blood pressure medications. And if their blood pressure stays at a reasonable level, then they can get off those medications. And if not, then don't do that. But, I don't tell a patient to not to do what their primary care doctor told them to do. But if you do it in an intelligent way and you involve the primary care doc or the cardiologist as part of the team, I've gotten a lot of patients off their blood pressure medication. It has a very positive effect on erectile function.
Awesome.
Doc, I'm curious, since we're talking about circulation, nitric oxide and things, how do you feel about red light LED therapy?
I love it. Yeah. Red light boosts mitochondria. And mitochondria are the powerhouse of cells. And another thing that I put a lot of my patients on, there are really two supplements that are by far and away have the most data. One is nitric oxide boosters, and the other is creatine. And I focus on muscle building in a lot of my patients, especially everyone talks about muscle building in 20-year-olds, 30-year-olds. If you want to build muscle in a 20-year-old, send him to McDonald's and then send him to the gym. Any idiot can build muscle in a 20-year-old. I mean, if you want to look like Mr. Olympia, it's a different story. But, 20-year-olds have a testosterone of 900. Everything works. Okay, but I deal with a different population. My guys are over 50. And it's hard to build muscle over the age of 50, right? Your nerves don't function as well. Your intestines don't function as well. So you don't absorb protein as well. You don't absorb macronutrients as well. Your mitochondria don't kick out ATP like they should. Your Golgi apparatus and your endoplasmic reticulum don't make proteins like they're supposed to. Your DNA is getting damaged. You get chronic inflammation from eating all the crap that we all eat. Because even if we try to eat well, there's plastics and all this kind of stuff floating around. And so it's hard to build muscle after 50. And guess what? Your testosterone drops 1 or 2% a year. Your insulin-like growth factor is dropping. Your human growth hormone's dropping. Everything's dropping. And guess what? Soon you're going to drop too. But there are things that you can do to extend your health span, not just lifespan, but health span, right? Your ability to stay healthy and active. And when I see my patients in their late 60s and 70s, a lot of these guys, I'm in the Bay Area. There's a lot of affluent people. They're really interesting people. They're Google, Apple, Facebook, Lawrence Livermore Lab, Oracle. They want to enjoy the rest of their life, right? And how do you enjoy the rest of your life? You need good muscle strength, especially in the legs, right? If you don't have good leg strength, guess what? As you get older, your balance goes, right? Because your eustachian tubes are messed up and the hair on the semicircular canals doesn't work as well. So you're more likely to fall, right? And your ligaments and tendons don't react as quickly. Your nerves don't work as well. So guess what? You're going to fall. But if you have better leg strength, you're much less likely to fall. Okay. So, one of the things I look at all the time in the in-body is leg strength. Guys are used to building beach muscles, right? Beach muscles are great when you're younger and you want to pick up chicks. But when you're 60 or 70 or 80 and you trip, you want to make sure that you have good leg muscles. Or if you're traveling and you got to walk upstairs or you got to walk around Rome for 3 or 4 hours in a day. Or you want to go play with your grandkids, it's leg strength, it's balance, it's core strength. Those are the things that are super important. And those are the kind of things that I focus on in my patients who are in their 60s and 70s and 80s, because that has so much more of a impact on quality of life than, building your biceps and triceps in the gym when you're 20s. But that's what everyone writes about. That's what all the pictures in the magazines, a 65-year-old guy with a sunken chest and wimpy biceps doesn't make for a good picture on the front of Muscle Digest. But those are the guys that really need it the most.
I love that. That message, is just so important. For us guys, David and I'm David, you're almost 40, right? Or you're just there.
Turned 40 this year, bro.
That's right.
Wow.
So, this is the time for us men to really step up and be proactive. And honestly, Judson, when you said you're in your 50s, man, I was like, there's no way. Like you're you look amazing. Like you're really.
It's that skinny filter.
He's full of shit. We know he's not. I mean, you're truly a testament to, like, you know, living the principles that you wrote about in your book, and I love everything you're sharing. And there's too many questions I've got for you. I would love to get you back on and dive into some more, but the stuff you shared today was really powerful stuff. You know, really important stuff that all of us men are thinking about. Maybe, you know, in the back of our mind initially, but it's something that becomes a real issue as you know, more time goes on. So I want to sort of get your thoughts on a quote that I love. And when I read this quote, I'm like, yeah, you know, I'm one of his tribe. I get where you're going with this. And it was a Tolkien quote. And, you know, it's everything that you're speaking to right now. And the Tolkien quote, J.R. Tolkien, you know, the Lord of the Rings guy, for those of you guys who are tuning in and don't know who that is. So all we have to decide is what to do with the time that is given to us. And man, like, what you're presenting here is really that. Like, we all have a choice to stand up and be so much more than you know, than how we're living this life. We live in a world just so deep in complacency, and we just let, you know, life happen to us. And you know, you're sharing such powerful information. It's allowing people to take life by the reins and really do something about it. And it's time for us men to really step out into that possibility, and not just kind of, oh, I'm just going to deal with that. I'm just going to let that, you know, show up in my life, and it's gonna be another thing I pack on to, you know, to the reality of living in this body. Like, no, like, let's do something different and speak to that health span as you did. So any you know, last thoughts before we say goodbye today, Judson?
Yeah, I mean, that quote, honestly, that I get shivers up my spine every time I hear that quote, because it means so much to me. Because there's another chapter in the book that really meant a lot to me that Robert Bonfiglio, the president of the California Psychological Association, wrote, and I asked him to write it on the work-life balance. And after he wrote it and I read it, I said, you know, I want, it's so important to me that I need to put my 2 cents in there. And so I wrote a 2-page kind of sidebar called the work-life pendulum. Because to me, there's never really a balance. Very, very few people I've ever met that said, you know, I'm perfectly balanced between work and life. You know, for me, it's always a pendulum. Like, either I'm working too much and I have to pull back, and then, you know, not that I'm spending too much time with the kids, but, you know, the demands of work need to take over. And so it's like, you hope that the pendulum doesn't swing too far into divorce, or, you know, into losing your job because, you know, you're goofing off at work. You just try to keep that pendulum in some sort of reasonable range so that you can have the best of both worlds. But the other theme that I use to frame the book is the hero's journey. And you know, when your listeners get the book, I'd recommend that they read because it's a massive book, over 900 pages, but it's not 900 pages for everyone. Read the introduction, read how to read this book, and then read the first chapter, which is the hero's journey, and then go through the table of contents and find the chapters that really relate to you. But the concept of the hero's journey is that you're the hero of your own journey. You know, Tiger Woods, you know, he's a hero, sports hero, but he's got his own journey. He's got his own problems, you know, or anyone that's in the news that you think is great. They have their own journey. They have their own problems. No one goes through life and has everything perfect. But it's up to you to focus on yourself and the decisions that you make, because you can be the hero of your family. You can be the hero of your workplace. You can be the hero of your community or your church or your, you know, wherever you associate with people, you can be the hero, and the decisions that you make and how you allocate your time and your energy really can be impactful. And so really focus in a mindful way on the decisions you make and how they impact you and the people around you.
Love it.
And that's really what the book is about, is to help you take good care of yourself so that you can take care of yourself and you can take care of other people around you.
It's amazing.
Doc, thank you, Dan. This was awesome. It was a blast hanging out with you today.
Hey, thanks for having me.
Mm-hmm.
Yeah, it's a pleasure.
I love that before we got a chance to connect with you on the call here, you send a picture of your gorgeous family. You know, you're truly a family man, you know, not afraid to, you know, speak his truth to the world, and you know, no doubt your passion for what you do is rubbed off on your children. And thanks for being a Dr. Dad, man. Like it's
thanks
great
a lot.
to
But
connect
you know,
with you.
I send those pictures, but you know, that's like what we look like on our best day.
No, it's
There's a lot of work that goes into like gathering all that.
yeah, no,
I
get it.
Yeah.
I get it.
So, but anyway,
Yeah,
that's a Facebook moment for you right there.
Yeah, that's it. That's where we're living our best life on Facebook. And beautiful pictures. All right, Doc. Thank you so much.
Hey,
like
thanks
said,
a lot, Nick. Thanks a lot.
we got a fraction of this brilliance. So
yeah.
you know.
You gotta. People have to buy the book. You know,
Yeah.
I put my heart and soul in everything that I've learned over the past 25 years about men's health, and everyone in my network of consultants and all of what they know, and it's available for anyone at the 21stcenturyman.com. All letters. And if you want to pick up some supplements, it's at affirmscience.com. And if you want to learn about me, it's brandeismd.com and our clinical research and all the cool stuff that we're doing in Northern California.
Amazing. Yeah, we'll put all that in the show notes as well. Thank you for sharing.
You got it.
And yeah, look forward to the next time we get to connect.
Awesome.
Take
Thanks
care.
a lot.
Thanks,
Bye-bye.
Doc.
Thanks for listening. If you enjoyed today's podcast, please be sure to subscribe to the Dr. Dads and share with your family and friends. You can also follow and interact with Dr. Nick and Dr. David on Facebook and Instagram for a daily dose of inspiration and the latest in health and wellness. Be well.